I am the surgeon on call. Did you page me?
Hey. Sorry to bother you. I got this guy. The CAT scan shows a bowel obstruction and appendicitis.
Can you tell me more?
There are mildly dilated loops. No transition point is seen. The appendix is upper limits of normal. There is no adjacent inflammation. Early appendicitis and an early partial obstruction cannot be ruled out entirely but are thought less likely. Clinical correlation requested.
Anything else?
His name is Mr. Jones. He called his primary care physician's office at lunchtime. They were closed for 2 hours. When he did get through, they could not see him for 3 months. They sent him here. He needs an operation for his bowel obstruction and appendicitis. Do you want me to write admit orders?
Can you give me some history?
Certainly. He came back from CT about 2 hours ago. I just got the reading. It shows a bowel obstruction and appendicitis.
No, I mean some history before he got to the hospital and maybe a physical exam.
He had abdominal pain. The CAT scan shows a bowel obstruction and appendicitis. I wrote admission orders for you.
Come on. You got to help me out more than that.
Certainly. I gave him 2 of Dilaudid and 25 of Phenergan. He is a little sleepy now.
Was he nauseated?
Yes. The CAT scan showed a bowel obstruction and appendicitis. He must be nauseated.
Did you talk to this man and examine him before you ordered the CAT scan?
Yes, of course. He began to have abdominal pain in the right upper quadrant that radiated to his right shoulder after eating fried chicken. His eyes looked a little yellow. I was thinking kidney stone, so I got a non-contrast CT. I was a bit surprised to learn he has a bowel obstruction and appendicitis. Do you want me to get a consent form for you?
Wait. Would not a right upper quadrant ultrasound be a better test for right upper quadrant abdominal pain and jaundice?
It would not have shown the bowel obstruction and appendicitis.
Has he had any surgery before?
Let me check the computer. Oops, wrong patient. Wait a minute. There is no surgical history listed.
Does he have any scars on his abdomen?
Let me check the computer. Sorry, I cannot find scars in the computer. His religious preference is Methodist. Does that help you any?
Do we have any labs back?
I did not get any down here. My shift is about to end and I did not want to have a bunch of loose ends for the next guy. I wrote for a lactate, urine pregnancy, D-dimer and troponin as soon as he hits the floor. I sent his stool for over and parasites as well as fecal fat. Should I call your resident? I started him on doripenem, vancomycin and diflucan for you. The cafeteria was about to close but we were able to get him a tray as he said he was starving. While you were down here, can I run a few more by you? I would like to get your thoughts. Would you mind looking at a belly film for me? There is a small perirectal abscess down here but it is close to the anus and I am afraid. Should I call your resident? Should I call your resident?